It was the beginning of April. I was contacted saying that everything was going virtual. It was just a safety measure during the pandemic. My depression and my anxiety were at the forefront of my mind and really affecting how I was living my life on a daily basis. I contacted Atrium Health. We figured out that I have OCPD, or obsessive compulsive personality disorder, and she recommended that I start talk therapy.
Mandy and I started working together a couple of years ago, and she has been a pleasure to work with. She's been a really hardworking client, and I find that when clients are very hardworking, they benefit more from psychotherapy. She learned to manage her disorders. She went into partial remission. She had a baby girl early on in the pandemic, and at that point, we easily switched over to virtual visits. It's been fairly eye-opening in some cases, and we get to see a different side of our clients. And likewise, they get to see a different side of us as well when we're working from home. Prior to the pandemic, our no-show rate was 14%. Transitioning over to virtual visits during the pandemic has reduced the no-show rate down to 9%.
I live about an hour away from the office, so it was a relief that they went virtual and I was able to be close to my baby if she needed anything during my appointment. I 100% believe that virtual visits were so much better for me than the in-person visits. I got the exact same treatment, except I didn't have the anxiety levels of trying to make it to the office.
I just make sure that I'm sitting in a private area, and my family is in a different part of the house, and that works well as far as privacy and confidentiality. Another benefit of virtual therapy is that we don't have to wear our PPE. People are able to see our faces very clearly. We're able to have clear conversations directly.
With virtual visits, I got to focus more on the therapy and on myself and how I'm dealing with everything. So that really helped with my peace of mind.